So this next section is actually in the spirit of the whole meeting, actually, using metrics locally. We have three people that we're going to hear from, and delighted to have Julie Willems Van Dijk as the moderator of this session. Julie is a public health professional and ran the public health department in Marathon County in central Wisconsin for many years. And 6 years ago, we were smart enough to entice her to come down to the Population Health Institute, where she now serves as co-director of the County Rankings and Roadmaps project in our Population Health Institute. Julie, thank you for doing this for us.
So it's great to be with you this morning, and my job, I think, as the moderator is to provide the linkage from what we were talking about to what we're going to talk about. So I want to just spend a couple of moments, as Dave said. What I've learned I am is a term that I heard Glenn Mays coin, which is I'm a pracademic, which is someone who lived in the real world doing this work, as many of you in this room are doing, and then has spent also a good part of my career trying to understand more and build new knowledge about this work, but do it in a really practical way. So I think that's what this panel will do, is provide that linkage from what we were discussing on a more conceptual level to how it plays out in real communities. I know we kept hearing that you were going to hear more about the County Health Rankings and Roadmaps, and I actually don't plan to spend a lot of time talking about the County Health Rankings and Roadmaps, but I am here all day and over lunch. If anybody has any questions or concerns or thoughts about rankings and roadmaps, I am here and very open to speaking with you. But I put our model up, which Steve has already shared with you. And I think what I want to say is, I'm also a Baptist minister's daughter, so I also want to say amen to a lot of what we heard this morning. Yes, this is about making this more local, and yes, county is not an actionable level for most communities. We've learned that over the last 6 years, and we're working on ways to better link people to better local data, but so are you, and so we want to link them to you. Yes, equity is important, and it is incredibly important. We added one measure this year on income inequality to start to get at equity within a county instead of just comparing counties to counties. And it is an important and ultimately important area for focusing action. Yes, I'm with Alonzo. I'm not about the definition and the misperceptions about the word health in other sectors. I'm not sure we're ready to rebrand as the county well-being rankings. But I've often thought that is a barrier, is even using the term health. And yes, data has to be about purpose first, as Raj said. Purpose first, and I think that's really what this panel is going to talk about. The County Health Rankings is not primarily a data project. I say that with great respect for my colleagues who do the data. It is about using data to raise awareness about this model, about putting some pieces of data in context so that we wake up people who don't understand what's happening in their community. So this serves as a call to action. And clearly, the County Health Rankings were only and are only intended to be a starting point for a data discussion. So what I've also found about this model is people can relate to it, they can put their arms around it, and so it's not perfect, but at least it gets us in the space of the discussions to move forward. And in particular, it is assisting with moving the discussion about social and economic factors from one that are demographics we report in a community health assessment to actionable areas for improving the health of our communities. So this is our take action model, and when you hear about the county health roadmaps, one of the things we've done and one of the best kept secrets about county health rankings and roadmaps is the tools and resources associated with this action model. We have aggregated much of the good work of people in this room and beyond to help community leaders who want to take action, think about how they work together, how they assess needs and resources, focus on what's important, and you can go into the Action Center and find succinct guidance and linkages to numerous tools to help you do that in your community, including a very robust evidence analysis tool called What Works for Health that we've basically done the lit review and rated the evidence for communities to know where to target their actions. So what we're going to do today is really talk about data to action. We're going to talk about moving beyond doing our community health assessment. My goal in my career is to get rid of that terminology. We shouldn't just stop and do a community health assessment. It should be ongoing part of our work. And so we need to use data to identify the most important areas and then target our actions. And you're going to hear about that here, and you already have from the earlier presentations. We need to use it to monitor and track progress as defined locally in a meaningful way. And we need to use it to leverage those important mandatory assessments like the IRS requires of hospitals or the FAB process requires of local health departments, or some states require of local health departments, and voluntary assessments like the great work that United Way of Santa Cruz does in a community. We need to leverage those tools for meaningful action so that we don't stand on this action cycle with us spending 90% of the time on the side of the action cycle that's about assess and focus, and 10% over on the side that's about actually doing something meaningful to improve health. So that's what this session is about. And without further ado, I want to introduce you first to Megan Joseph, who is my great friend, first of all, and I'll get you her exact title. Megan is from the United Way of Santa Cruz, and I had the great privilege of meeting her several years ago when Santa Cruz County was a finalist for the RWJF Culture of Health Prize, and ultimately a recipient. And I got a chance to see this work in action. And what I'm really excited about is the work Megan's going to talk about we didn't see 3 years ago when we were in Santa Cruz, so it shows that the journey continues. She is the Director of Community Organizing with United Way of Santa Cruz, and I just love my Santa Cruz friends who have a community organizing division within the United Way. And after Megan is done, we will hear from my other friend, Michael Bilton, who is the Senior Director of Community Health and Benefits at Dignity Health in California. I know Michael from his years with the American Hospital Association, leading work around community health improvement, and have had the privilege of serving on several initiatives with him. So we will now have our real-life practitioners take it away. Megan.